All right, we're going to talk about a comparison of paleo diet with the vegan diet. First of all, I want to clarify for purposes of this lecture, I'm going to consider keto diet something separately. The version of the keto diet I'm familiar with is the one promoted by Dr. Palmer at Harvard. Keto diet arose in the past out of treatment of refractory epilepsy, and it's a very high-fat diet, 80 to 85% fat. It's done under medical supervision, and it's not easy to eat that, and they'll check the person's urinary ketones to make sure they're in ketosis. So that's sort of a separate subject. Low carb and paleo, I know you can define these things in a little bit different ways. For our purposes, it's going to be meaning that somebody who avoids carbohydrates eats a significant amount of meat. And now, is there anything good about paleo diet? Yeah, there's some good things. They avoid simple sugars. They try to avoid fructose, like especially all the industrial fructose in processed foods, things like soda pop and whatnot, energy drinks. They'll avoid sucrose, simple table sugar, because that also has a significant amount of fructose in it. They avoid factory farm meat. It's good to avoid that. They avoid processed food. That's good. They avoid vegetable oils in general, the ones I'm familiar with. So there are some good things about paleo diet, but there's still a fundamental problem. They eat a lot of meat. Meat is basically primarily saturated fat and animal protein. Saturated fat and animal protein are both bad for you. Plant foods, the best plant food is starch. Starch is not only cheap, you can live very cheap and be very healthy eating starch. And that could be like 85% of your calories. Okinawans eat 85% of their calories, sweet potatoes, and they're like one of the, perhaps the healthiest people in the world when they ate that way. Starch is a polymer of glucose. Note that's glucose, not fructose. Glucose and fiber. They're both good for you. Okay, so if you look at the most common causes of death, premature death, number one cause of death in this country is myocardial infarction. Number two, and that's about, let's say 26%, cancer about 25%. Other very common important medical problems, obesity, diabetes, Alzheimer's disease, kidney failure, cancer. They're all increased risk with meat. When you eat significant amounts of meat, you increase your risk of premature death, and you dramatically increase your risk of premature disability due to obesity, diabetes, and all these other problems. And then you say to yourself, well, how can you be sure? You've heard contradictory information. How can you come to terms with this in your own mind so you're convinced about it one way or the other? Well, my recommendation would be look at epidemiology. The populations that eat starch-based diets, they're skinny. Look at the Chinese before 1970 when they ate tons of rice, 80% or more of their diet of rice. They're all skinny. Now that they're eating more meat and oil and junk food, they're fat. A lot of them are fat. Look at anthropology. If you look at the history, for example, they've unearthed some of the mummies and found out the pharaohs would have coronary artery disease. And there was no processed food or junk food back in those days. That's just from eating meat. They'd have calcified arterial vessels as an indicator of atherosclerosis. And if you look additionally at anthropology in terms of the history, I've seen research papers showing that they had to dig up a bunch of graveyards in Europe, and the ones where the rich people, the wealthy people, and some of the wealthy clergy and lived, their graveyards were full of people with lots of DISH, diffuse idiopathic skeletal hyperostosis, which is a degenerative condition of the spine, which I see every day, that's associated with obesity and diabetes. If one looks at the history of food in England and the United States, you will see that when they started introducing more and more meat, it became available to a person on a daily basis. In nature, it's kind of hard to obtain meat in comparison with obtaining plant foods. Once you started having more refrigeration, more railroad transportation to ship meat around, and people started eating a lot more meat, as well as I realize it's confounded. They ate a lot more sugar around 1900, and then in 1911 they introduced trans fat, all these things. But as the intake of meat, oils, and fructose goes up, all these atherosclerosis and degenerative diseases go up in amount. If you look at the old vegans, look at the old vegan, when I say vegan, I mean 100% plant-based diet that's low in fat, avoiding nuts and avocados and whatnot. They're really skinny. T. Colin Campbell, he's skinny as a toothpick. John McDougall, skinny as a toothpick. And he's about 85 years old. He's about 73. Caldwell Esselstyn's about 85. Skinny as a toothpick. He's got the best results of any doctor in the world. You put a patient on a 100% low-fat, plant-based diet, Caldwell Esselstyn, you get the best results in the entire world. I went and trained with him. He's for real. Caldwell Esselstyn, his books Prevent and Reverse Heart Disease. The best results in the world. No one's even close to his results. If you look at Michael Klaper, skinny in his old age. Walter Kempner, skinny in his old age. Look at Neil Bernard. He's skinny as a toothpick. He's like the male version of Audrey Hepburn, okay? That's what old vegans look like. They're skinny, they're healthy, they're mentally sharp, they're with it. You look at a lot of these old meat eaters and paleo types, I'm not going to say their names, but you'll find it on the internet. Many of them are quite fat. And I just know in my personal experience, the older vegetarian doctors, they tend to be skinny, pretty sharp, energetic, and mentally with it. And a lot of my meat eating doctor buddies and friends, I know them, the meat eaters tend to be fat and sick. It's just how it is. You can get away with eating a lot of this high meat and not the greatest diet when you're young. Up to about 40, you can compensate to a large degree with a lot of exercise. But you get, past 40, especially past 50, meat eaters just tend to become fat and have increased risk of diabetes, coronary artery disease, they're going for open heart surgery and all this other stuff. Why not prevent it? It is preventable if you eat healthy. Try these diets for yourself. Go for 4 months eating 100% low-fat, plant-based diet with starch to satisfy your hunger. You got to satisfy your hunger with starch to be successful. And I think you'll find that you feel a lot better. I know I felt better for years since I've gone that way. If you want to see some research papers to read about it, Peter Kuo's paper, Effective Lipemia on Peripheral and Coronary Circulation, 1959, American Journal of Medicine. That's a good article. What he showed was that there was about a 20% drop in the partial oxygen pressure with eating a high-fat meal that peaked at lipemia. And the point being, if you look at the top of the hemoglobin oxygen dissociation curve, it's relatively flat at top such that 20% doesn't really matter much to a healthy person, but to a person with compromised pulmonary function, let's say a smoker, that could be a big deal, or a person who's sick with an infection. Meyer Rosenman's paper with Friedman, 1964, Journal of Circulation, Serum Lipids and the Conjunctival Circulation. That's a good paper. They had a microscope, 80-time magnification, put it right on the conjunctiva, and they could see the arteries occluding, the little arterioles and capillaries at the peak of lipemia. They correlated peak of lipemia with blood tests. And so basically, it plugs up arteries. Some people have said, oh, there's no proof saturated fat is harmful to your health. What's the mechanism? There's plenty of mechanism, okay? Saturated fat. We talked about this in other lectures. The best lecture to watch would be the one I just did on what's the difference between plant foods and animal foods. Saturated fat causes rouleau formation, sticking together the RBCs due to increased LDL cholesterol, overcoming the zeta potential of the RBCs, and that leads to thicker blood, increased viscosity blood associated with increased blood pressure and increased development of atherosclerosis. In addition, those stuck together RBCs, rouleau, a stack of coins in French, makes it harder to oxygenate the tissues. In addition, saturated fat leads to incorporation of more sat fat in the plasma membrane, diabetic physiology with increased glycation of the RBCs, and you have decreased oxygenation of your tissues. It increases your risk of diabetes. It gets into the skeletal muscle cells faster than does the glucose postprandial after eating, and it causes insulin resistance. By the way, if you want to see the papers on saturated fat causing diabetes, you can check out the work of Dr. Shulman, and he showed with nuclear magnetic resonance increased intermyocellular lipid within the cells related to causing diabetes. In addition, the great paper of Michael Brownlee, Banting Lecture 2004, showing that sat fat causes diabetes. If you want to see the best paper written on the mechanism whereby LDL cholesterol, which is increased by sat fat, leads to sticking together RBCs, take a look at the paper by Gregory Sloop, MD. Gregory Sloop, MD is the best atherosclerosis expert in the world. Also, like I was saying, you feed a patient plant-based diet. Like I said, look at the work of Walter Kempner, Nathan Pritikin, Caldwell Esselstyn, John McDougall, Neil Bernard. Their lipids improve. They have lower risk of atherosclerosis, lower risk of diabetes. It's been proven over and over so many times. There's really no real debate. If you read the paper, go through it unbiased scientifically, you'll find that this is the case. When I first started out trying to understand healthy nutrition, I could care less. Nobody obviously look at me. I got 10 views on my videos. I have no sponsors. I have no connections to anybody. I'm one of the most unconnected people in the world practically, okay? And I can tell you, I just wanted to be healthy, and I wanted to understand atherosclerosis. I spent tons of time. I looked at many, many thousands of CT angiograms, many, many hundreds of catheter angiograms, and I just wanted to understand what's the deal with atherosclerosis. And I can tell you, fat is bad. Nathan Pritikin said that back in the 1970s. It's true. Fat is bad. It damages blood flow. And animal protein is bad too because it's a tumor promoter. We talked about that in my last lecture on the difference between animal protein and plant foods, animal foods and plant foods. And it increases your risk of kidney stones. Bottom line, you can't win with meat. I even used to hang on to liking skim milk for a while because it was convenient for cereals. But once I realized almost all the cereals are high in sodium, they tend to often have MSG in them, and the animal protein itself increasing your risk of prostate cancer, increasing cholesterol levels. I think it increases cholesterol levels because I think it causes a pro-anabolic state in the body that leads to increased cholesterol, even though it's not intrinsically lipid itself. So for those reasons, I think the paleo low-carb diet is a very bad idea for the health of a middle-aged and older person. I think a younger person who exercises a lot could probably get away with it before 35 years of age, but continuation beyond that point, I think they're at high risk to become obese and sick. So that's our summary for today on comparison to paleo and vegan diet.